Welcome you to this lecture on metastasis. This is a short lecture where I will be focusing on a certain common cancers and what are the common places that it usually metastasize. So let's start with the spinal. The spinal metastasis. The spinal metastasis arises from prostate, breast, and the lung cancers. They are the most common sources of spinal mets. The spinal mets can present with a spinal fracture or sometimes even cauda equina syndrome, or and it can also cause neurological deficits. The prostatic cancer causes osteoblastic lesions in the spine, whereas the breast and other cancers typically cause osteolytic lesions. The bone scans using technetium-99 labeled phosphate compounds detect the osteoblastic activity because it can bind it to hydroxyapatite at the sites of active bone remodeling, whereas the osteolytic lesions are not obvious in the bone scans. Choriocarcinoma. The choriocarcinoma, it can metastasize. The choriocarcinoma is the cancer that the hydatidiform mole has progressed to. Fine. The end stage of the H mole is the choriocarcinoma. That has a tropism for the lung as well as brain mets. What about Krukenberg's tumor? When the gastric cancer metastasis to the ovaries by hematogenous spread, then it is known as Krukenberg cancer. How will the ovarian biopsy be? The ovarian biopsy will contain signet ring cells containing mucin on ovarian biopsy. The gastric adenocarcinoma is the one commonly spreading to ovaries. Then omental metastasis happens in primary ovarian cancer. In primary ovarian cancer, it spreads to the omentum by a direct extension, resulting in caking of the omentum or omental thickening. This is because of the peritoneal dissemination that happens in an ovarian cancer. What about para-aortic lymph node drainage? The testicular cancer and the ovarian cancer will metastasize to the retroperitoneal lymph nodes. Why? This is because of the origin of the testis and the ovaries from the retroperitoneum. They share the common origin. Therefore, the testicular and the ovarian cancers will drain to the para-aortic lymph nodes, which are retroperitoneal lymph nodes.